pathway and the growth of Kaveri Hospital that we are launching this heart recovery program. And we have a very efficient and committed team of cardiologists, cardiothoracic surgeons, perfusionists, and all of us work together to save more cardiac lives and patients coming in with very critically ill state, especially with regard to heart failure and cardiogenic shock. So cardiogenic shock, I think you would have really heard about that. It's a very, very moribund situation where the patient comes with a heart attack and also a very low blood pressure, and the life is at stake at any time, and the mortality or the death rate is significantly higher, as close to 50 to 60% when they present with the low blood pressure and a massive heart attack. So today, with the launch of this IMPELLA Heart Recovery Program, we are delighted and extremely proud to say that this is one of the only institutions in the south of India to have this on board in the hospital, this IMPELLA pump. And most of the time we get this pump from outsources when it is not available in the hospital. So that may delay the delivery of the pump to the hospital and also delay the care, which is important. So the time is extremely vital and important, especially when a patient comes with very low blood pressure in a state of shock. Yeah, thank you for arranging that. So I'll just take you through a few minutes, about 8 to 10 minutes, on hemodynamic support to protect the heart during the percutaneous coronary intervention, which is in layman's terms called the coronary angioplasty and cardiogenic shock. So that is the picture of the IMPELLA heart pump, which you have already seen. And what do you mean by hemodynamics? Hemodynamics means understanding and the study and the flow dynamics of the blood from the heart to all the organs of the body, and it involves monitoring of the pressure in the heart as well as in the circulatory system, which involves monitoring pressures both in the heart chambers as well as in the arteries and the veins, and measuring the output of the blood ejected from the heart, which is called the cardiac output. So hemodynamics is essence of sustaining life. If there is very low blood pressure and poor volume of blood in the system, the life is at stake. So whenever the hemodynamics is stable, we mean that there is adequate oxygen supply to the blood, adequate oxygen supply to the human tissues, and delivers the fuel molecules for energy requirements, and removes and transports the waste products of metabolism, and therefore maintains the cellular integrity and vitality, and that's how the life continues in every one of us. So whenever the hemodynamics is unstable, the life is at stake and in jeopardy, and patient can die at any moment. So the patients come in multiple formats. You would have seen this in many, many situations, that not only that they may have a very massive heart attack, but along with that they may also have associated other disease conditions, like they may have a kidney failure, they may also have a lung failure or a chronic lung disease, they may also have a very poorly controlled diabetes, they may have a disease in the other vessels like the vessels of the legs, and also sometimes they would have had a stroke in the past. So the patient's comorbidities adds additional risk to the patient already who is at a very, very moribund state. And added to that, the patients may have multiple blocks in the main arteries to the left side. It's called the left main artery, and it adds to multiple need for interventions in the form of using various devices, which in fact delays the procedure and takes a long duration of the procedure. So during the long duration of the procedure, the patient has to remain stable, the blood pressure has to be stable, and they have to be maintaining an adequate blood circulation to all systems of the body, not necessarily the heart, but also the brain, liver, kidney, and also the rest of the tissues. So that's where the hemodynamic compromise should be avoided, and that's the situation where the heart pump, which is the pump which is seen here. This is a very, very miniature, the world's smallest heart pump, which supports the heart robustly during such crisis situations. So IMPELLA recovers the heart and saves life. While the heart is put to rest, it recovers the heart instantly, and also the recovery process of the heart is hastened, and when the blood is drawn from the heart chamber, the heart doesn't have to pump adequately, so it is given much rest, and therefore when the heart is resting, the blood pressure is still maintained for the other systems of the human body, and the oxygen requirement for the heart becomes remarkably less, and that's how the heart starts recovering faster. At the same time, simultaneously, as I said, it maintains this pump, maintains the circulation of blood flow, feeding the body and and other organs, sustaining vitality of the life, and that improves the survival in such critical situations. No other device exists that can be introduced into the heart without a surgery, and this is one of the most advantageous situations because we can introduce this in a very few minutes of 1 or 2 minutes time right into the heart and starts supporting the heart for the optimal hemodynamic support. So these are the pumps which is inserted from the groin, or maybe sometimes from the upper hand, from the arteries of the hand, and then directly goes into the left ventricle. And if you see the multiple impellers available and supports available, the commonly used is the intra-aortic balloon pump, and the intra-aortic balloon pump gives only a support of 500 ml per minute. That is the support that gives additional to what the heart pumps. If you take an Impella, which comes in 2.5 CP, which can give much more, and Impella 5, which is all the figures indicating how much it can deliver, you can see that it can deliver up to 2.5 liters to 3.7 or 5 liters, depending on what is the Impella type pump which is inserted. So this is add-on to what the heart is already ejecting or pumping. So it gives an additional pump from the left ventricle, which is already failing. So as we know that the blood flow increases and the arterial pressure increases, and therefore the cardiac output or cardiac power output increases. At the same time, as it draws the blood from the left ventricle, the pressure inside the left ventricle, the walls, pressure inside within the walls of the left ventricle becomes less, what we call medically as the left ventricular end-diastolic pressure or end-diastolic volume, and therefore the heart becomes less, and it increases the oxygen supply because of the increase in blood flow and circulation, and also simultaneously it reduces the oxygen demand, and that's the most coupled advantage of using this pump. Increases the blood flow and oxygen supply as well as reduces the oxygen need for the heart muscle that allows recovery. So as you see that in this, the native heart pumps around 1.7 liters, and if you put an Impella 2.5, that adds on to 2.5 extra, so you get around 4.1 liters or 4.2 liters of the circulation in this patient. So you get an additional augmentation of the blood circulation. So this you would definitely appreciate that this is a very, very weak heart, and once the Impella is inside, you can see the double line there, which is the tube which has gone, or the pump tube gone into the left ventricle, and the moment the heart is put to rest and the blood is drawn, you can see the effective contraction, and the way the heart pumps and recovers is quite evident in this movie. So you would appreciate the first movie, which is on the left hand side, is a weak heart. It doesn't vigorously move, and on the left hand side, right hand side, you can see it moves very, very vigorously. That means the heart is already recovered. So you will increase the mean arterial pressure, cardiac output is increased, cardiac power output is increased, pulmonary capillary wedge pressure, which is the pressure inside the capillaries of the heart in the lungs. So whenever the heart pressure increases on the left side, it gets reflected back into the lungs, and the lung pressure increases, and therefore it relieves the congestion in the lungs and improves the oxygen ventilation and oxygen supply. One of the important aspects of Impella is that it improves the coronary flow, which is a flow to the coronary arteries and myocardial perfusion. As they increase the performance level, there are multiple performance levels which will give higher support. P1, P3, P6 and P9, these are the performance levels of the pump. As you see that it increases, and higher the performance of the pump, lower is the resistance to the flow, and therefore it proportionately increases the flow in the smaller vessels of coronary blood flow. So I'll go to the cases now. So what is reflected after the perfusion to the tissues and other organs is that the end product of metabolism in a low flow situation, when the oxygen not supplied, is the lactic acid. So the lactic acid becomes lesser and lesser and becomes the least with the increasing blood circulation, and therefore the tissues are getting adequately oxygenized and oxidative metabolism continues instead of without oxygen with the anaerobic metabolism. So IMPELLA reduces both the operative as well as post-operative mortality or death rates in patients up to 90 days, and is shown in various trials up to 30 days, 30% reduction in the major adverse cerebral and cardiac events. So let me take you through the couple of cases that we had in this hospital. This is an 81-year-old gentleman who used to walk 7 kilometers every day, and then he started complaining of chest pain one day and was rapidly progressing. He could not even walk 1 kilometer as compared to what he was walking about 7 kilometers. He also had diabetes, kidney disease, he had obstructive pulmonary disease, he is a survivor of cancer prostate, he had a pacemaker, atrial fibrillation, so rhythm disorder of the heart, obstructive sleep apnea, peripheral arterial disease, hypertension. So he had multiple other disorders along with this increasing chest pain, and developed acute coronary syndrome or heart attack in the hospital, which slowly or immediately went into acute heart failure. So we checked the pressures inside the heart chambers, and you would see the pressures are all elevated. The right atrium, right ventricle, pulmonary wedge, which is the pressures from the left side of the heart measured through the lungs, and the pulmonary artery, which is the pressures in the pulmonary artery. So all these pressures were remarkably elevated, indicating the patient has an acute heart failure, and you have these values. The pumping efficiency was only 36%, and they needed multiple supports of medicines to increase and maintain the pressures. So this is the angiogram showing the left side artery is almost 95 to 99% completely occluded or narrowed, and there's a heavy calcium in that vessel, and it's very difficult to do this with a simple angioplasty procedure. You will have to use instruments to drill through this, and this is a patient who was on this IMPELLA pump. You would appreciate that there is an IMPELLA pump inside, and we supported that even before the angioplasty started. That's how it is done. And then you will see a drilling burr goes inside the left side arteries into the left main artery, and that gives us some passage. You will see that is a image taken from inside the vessel, the OCT, which gives a heap of calcium there, has been excavated and burred through the rotablation burr. And then there was multiple balloon dilatations with the shockwave technology, and finally we could achieve a very good result. So you will see that the vessel was fully open and blood flow was restored, and this whole procedure took around 6.5 hours, and the whole patient throughout the procedure was remaining very stable because the circulation was well supported by this IMPELLA pump, which you could see that it is functioning inside the left ventricle. So soon after that, patient, the IMPELLA pump was removed, and he remained stable. You will see the blood pressure is 123 by 75, his oxygen is 100%, he breathes normally, and his heart rate is 63. So it makes the procedure very simple and allows us to continue with such kind of a high-risk procedure with a high level of confidence, in the sense the patient will remain stable and protected, and that's why it's called the protected PCI. And we have various methods by which we choose this. Whenever the heart pumping is less than 20%, you invariably require some pump support when you do angioplasty. If it is between 20 and 35%, you will need IMPELLA if it is a very high risk or complex procedures like what I showed in now. Now the second case is an 83-year-old lady who had diabetes, high blood pressure, and she had a heart attack 10 years back and was on medical treatment. She came to our emergency from another hospital with a history of breathlessness. She also reported fever for 2 days. RT-PCR was negative. Echocardiogram showed heart pumping was only 35%, and she was later shifted to a coronary care facility, and she had a swelling of her legs and congestion in the lungs, and the oxygen was only 78%. She had a third heart sound, which indicates a heart failure, and the blood pressure was 112 by 68 with some medications. Soon after she was being treated medically because of the age and under the fever, she developed a cardiac arrest, and the ECG subsequent to that showed a significant abnormality indicating a critical block, and she had subsequently 2 more cardiac arrests with the ventricular tachycardia and fibrillation, and again revived. So after the cardiac arrest, you will see that from 36% the ejection fraction or the pumping efficiency has dropped to 25%. And she had a grade 3 mitral regurgitation and high pulmonary artery pressure, which is the pressure inside the lungs. Unfortunately, when we took her up for the procedure, she had blocked vessels in the legs, which is seen here. The vessels going to both the legs. You can see there is a chunks of calcium or nodules, what we call obstructing the flow. So we can't access the heart from the legs, and therefore we had to open that with a shockwave technology and improve the flow. And the angiogram performed showed almost 99% narrowing of the left main, and patient had low blood pressure. You would see the pressure was less than 80, and this is the pulmonary wedge pressure was 18, which indicates a significantly markedly elevated lungs. So after the calcium was removed by shockwave technology, we could get a passage to insert the impella from the left side and from the right side, and then the impella pump was put inside the left ventricle, and patient blood pressure had remarkably improved from less than 80 to 105, 110 systolic. So that's the kind of support that we get. Not only protects the heart, but also protects the whole human body and other organs. And then the angioplasty could be completed, and post angioplasty you will see that blood pressure had remained quite stable. I would also take you to some of the important understanding of how the tissues suffer from low circulation and cardiac arrest. So you would see that lactic acid at baseline before we started was 2.15. It has gone to 15, which is 7 times high. And then after the pump was put in, it had come back to almost a baseline of 2.7. Again, the oxygen, which was 53 at baseline, had improved to 88, which increased. The lungs are also decongested. The left ventricle performance in various parameters had improved. And this is how the ejection fraction was there, and she could be weaned off from ventricle from the angioplasty and also the pump. So I will take you to the last slide in the interest of the time. Yeah. So hemodynamic support by way of mechanical circulatory support, Impella pump, which is available now within the hospital at any time round the clock, is very essential and critical necessity for high-risk angioplasty and cardiogenic shock to support the circulatory system. Percutaneous insertion, which means we can insert this pump through the skin without a need for any cut down or open surgery. So a non-surgical method of inserting this is a delightful experience, not only for the doctors and specialists like us, but also for the patient, and gives the best possible chance for the patient to survive. Impella efficiently saves the heart, it feeds the body, and is the best way forward for any patient who can come in this critically ill situation when the life is at stake. We have a wonderful team of interventional cardiology colleagues, cardiovascular thoracic team, the perfusionists, cath lab personnel, and LV assist support device personnel, which all work together to give the best supportive care for the patient to survive. Kaveri Hospital, I should thank the management for inducting this into our management on a day-to-day basis. And we have the machines, we have the men, we have the mind, and to recover the failing hearts. Thank you for your attention.